When I was told my diagnosis, it was through my GP surgery, and my own GP didn't pick it up, but they had a locum GP in. And because I was very anemic and very tired, had pelvic pain, we'd gone down the route of thinking it was menopause, whereas in fact when the locum GP had asked for this blood test and it came back and she told me it was myeloma, I was on my own. I didn't have anybody with me. My husband wasn't in with me. So it was just complete shock. And the impact on the family was equally devastating. So soon after I had seen the GP, and she told me she'd referred me to a haematologist and I would be seen within 2 weeks, which I was. So I met my haematologist and she gave me a thorough examination, and she immediately began to talk about treatments and the fact that I was of an age where I could be considered for stem cell treatment. But first I had to go through the CTD, that's the cyclophosphamide, thalidomide and dexamethasone. And then see how I responded to that. But she, I think pretty early in my first or second meeting with my haematologist, she mentioned stem cell transplant. But it just, I don't think I really took it on board at that stage. I was just trying to deal with the diagnosis, the immediate test, the bone scan, dental treatment as well I had to have. So there was a lot to deal with, and I think I didn't think about the stem cell treatment too early. You know, I was sort of taking one step at a time. Well, again, talking to my consultant, and in fact I saw a different consultant another time, and he was very talking up the stem cell transplant as being the optimum treatment. And when I thought about it, I thought it's going to give me the best chance. And if they're saying I'm, fit to go through it, then I want to go ahead with it. But I think at the same time I was quite obviously anxious and didn't really understand what it involved. But thankfully, knowing about Myeloma UK, I was able to look on the website and also found out that there was a support group here in Edinburgh. And so I took the step of coming along to a support group, and I met people there who'd had stem cell transplants. In fact, a couple of people had had 2 transplants, and they seemed to be fine and getting on with their lives. I mean, they were also realistic about it when I began to ask what was involved. I had an original date for my stem cell transplant before Christmas last year, but because I didn't want to be laid low at Christmas, I asked if it could be deferred till the beginning of the year. And but in the meantime, what happened was my paraprotein levels went back up. They had gone down to 4 and they'd gone back up to 10. So the doctors said they weren't willing to go ahead with the stem cell transplant with my paraprotein level that high, and they wanted me to go on to Velcade. So I actually had 4 cycles of Velcade before I went to have the stem cell transplant. So that was a bit of a setback. So it meant I went through all the investigations twice. But obviously it allowed me to have the stem cell. They didn't find any problems. So it all went ahead, but later than first planned. Well, I think had I not, as I said, met people who'd been through it, I think I would have been really terrified. I mean, I was anxious, but I think I was quite well prepared for what to expect. And I talked about it with my family, and my husband was there with me all the way. And I knew they'd be, initially I just wanted my husband to come and visit. And I'd said, friends who said they wanted to visit, I said, well, wait and see how I feel. And in the event, I didn't feel like seeing friends. It was just family who came in to see me. But going in, I was just... I knew the steps that I was going to go through because I had, read the leaflets and been informed, and also talked it through with the doctors. And also what I had done was I went into the ward a week beforehand just to go and talk to one of the nurses and be, shown around and talked through exactly what to expect and get advice about what to bring in. So I think I went in feeling actually quite positive and quite prepared, although I knew I was going to have a rough time for a while. The first few days, I had my high-dose chemo the very first day I went in, I had the central line installed, the Hickman line, in the morning, and that afternoon I was admitted onto the ward and given the high-dose chemo. I then had a day's rest, and the following day I had the stem cells returned. Actually, they did it over 2 days, and at that point I was still feeling quite well and quite positive. But it was when my blood count went down, of course, that's when I started to feel really rather rough, and I had problems with my mouth, with eating, because my mouth got very sore, and my appetite went right down. So that's when I started to feel really low, and they had warned me that would happen, and for about 5 days I was really quite poorly, just feeling really rotten and tired. And I mean, I remember one friend, actually a close friend, did come to visit me, and I just I could hardly lift my head off the pillow to talk to her, you know. So I think she got a bit of a shock seeing me like that. But then my blood count started to come up, and I needed some nutrition, supplementary nutrition overnight, because I wasn't eating, and I had to have 1 blood transfusion. That was all. I didn't have to have any platelets, and I think the doctors were quite pleased how quickly my blood count came up, and I started to feel better. I still couldn't really eat very much, but I had supplements, and the dietitian came to see me. So, you know, I sort of got through it, really. Well, obviously I think it was hard for them, and hard to see me in the hospital bed like that. I've always been a fit and active person. But, you know, we talked it all through beforehand, and they knew what to expect, I think, although in the event it's still quite shocking, quite hard. But I think they were taking their guide from me, because I was being quite positive and upbeat, even though I was obviously feeling quite rough. And I just, you know, was so sure this was the best thing to do, and that I was doing the right thing. And I was fortunate I didn't have too many bad side effects. I was only a little bit nauseous. So, you know, I think for the family seeing me, it was hard, but they were there for me as well, and they got me through it, really. Get tired still, and have to have rests now and then, go to bed early. But otherwise I'm, you know, getting on with my life now. But up till now, they've been happy with my bloods and how I've been since the stem cell, and the paraprotein level is undetectable now, which is wonderful. I think it is something to consider very carefully, and to get as much information about beforehand as possible. Certainly meeting and talking with someone who has already been through it, I think, is one of the most important pieces of advice I could give, because it's made a huge difference to me. And I think, again, obviously talking it through with your doctors as well, the pros and cons. I don't think you're ever really fully prepared for how you're going to feel. It's only if you've been through it that, you know, you can explain to anyone. But everybody's different and reacts differently, so you never really know how you're going to be. But I think from my experience, I would say, you know, it's something you get through, and it's worth it to come out the other side and feel, you know, you can get on with your life again. Well, I remember saying to one of the nurses when I was lying there and feeling my worst, saying, "Oh, I don't know if I could ever go through this again," you know. And then talking to someone I'd met at the support group afterwards, and they're facing the prospect of a second stem cell transplant, and they said, well, actually, you do forget what it's like, and then when the time comes again, you think, yes, if this is going to give me the best chance, then I would go through it again.